Hello, I will be presenting the systematic review with dose response network meta-analysis on treatment dose increase versus co-medication in allergic rhinitis. And this is a systematic review that is informing the ARIA guidelines. In particular, in the ARIA YAKI guidelines, there was a question on whether we should do co-medication, that is, adding more than one medication versus up-dosing medication, increasing the dose of medication in patients with allergic rhinitis that is poorly controlled despite pharmacological treatment with monotherapy in standard doses. And this implies comparing strategies in co-medication versus in medication dose increase. But this is something that has not been directly done by primary studies. So what we have done was a methodological approach that in which we can handle the different doses of the same medication, and we can actually model these dose response relationships, predicting what happens if we would be giving a certain dose of a medication instead of others. And so what we have done was we compared the different treatments when they were used with other medication versus using the double dose of a single medication in monotherapy. And what we observed is that when we comparing doubling the dose of intranasal antihistamines versus combinations of antihistamines plus corticosteroids, there were some mixed results for the total nasal symptom score and for the rhinoconjunctivitis quality of life questionnaire, but mostly favoring the fixed combinations. On the other hand, doubling the dose of intranasal antihistamines was preferred to adding an oral antihistamine to the nasal antihistamines, particularly in terms of nasal symptoms. When it comes down to nasal corticosteroids, doubling their dose was preferable to the use of combinations with corticosteroids and nasal antihistamines, both in terms of nasal symptoms and in terms of quality of life. And it was preferred as well compared to adding an oral antihistamines in terms of quality of life. In terms of nasal symptoms, there was no favored option. Regarding oral antihistamines, doubling their dose was not the best option when we compared it to combinations with corticosteroids. That means that results were more favorable to doing a nasal corticosteroids plus an oral antihistamine than to doubling the dose of oral antihistamine. And this was observed both for nasal symptoms and for quality of life. Thank you for your attention.